No matter where you live, going to the doctors can be a stressful thing. That may be down to the reason for the visit, but you may also be concerned about the quality of care or the bill you'll have to pay on the way out. Before a trip to the clinic, though, some people in Taiwan come to temples like this to pray for good health. And that's despite the healthcare system here being considered one of the world's best. But with a rapidly aging society and higher wages pulling medical professionals overseas, its foundations are increasingly under strain. In this episode of Gen Taiwan, we hear from the frontline workers confronting the challenges facing Taiwan's healthcare system.
Taiwan has what is considered one of the world's best healthcare insurance programs, a single-payer system run by the government. Patients pay a premium benchmarked to their income and co-payments to a GP cost of around $2.50.
例如说，你如果得了脑瘤啊，或者是一些先天性罕见疾病，那我们帮病人做一些手术，大概部分负担 10% 的话，大概就是2万块到5万块之间，不会超过。
But this low-cost approach is cracking.
每一天都要接近40至45人，这个量，我好像没有办法知道这个病人到底发生什么事情。纵使这个病人看起来有好转，我也不知道为什么；没有好转，我也不知道为什么。这种状况其实是很令人沮丧的。
Declining birth rates and an aging population are adding more pressure to the system.
医院都找不到护理师，这么差的薪水，然后这么辛苦的工作，连我们台北荣总这么大的医学中心也面临护理师不足、医师不足的困境。
Vice journeys inside one of the world's best healthcare systems to find out why it's cracking.
So 就我的脸会脸痛脸嘛，然后眼睛有复视，然后会头痛。
那因为他的住家那边非常方便，很多家的，每一家的
几乎都看过，
对，诊所都看过，包含中医师。那中医师说，他不是肠胃炎的状况，那因为他的那时候状况，他也有会恶心、呕吐那样子的。后来就看到最后一位医师的时候，他说他的状况要到大医院去。
5、4、3、2、1，加油！
Upon admission at Taipei's Veteran General Hospital, 10-year-old Eason was diagnosed with rhabdomyosarcoma, a type of cancerous tumor that required surgery.
阿贝把头发全部剃掉，这样比较好工作。我那天我看到单子
4万，
没有健保的状况要240几万，那有健保的话是14万多，太多。那个14万多，我们就有1万多是在每天3餐的里面。
Taiwan's national health insurance scheme was implemented in 1995 and covers almost all of its citizens. Premiums are generally affordable. A family of 4 with a household income of $1,200 US pays around $77 US a month in premiums. This social health insurance covers inpatient and outpatient care, and even childbirth.
你看不出来哦，你看啊，环游世界啊，这个是
我那边有
什么东正教，然后你看这个是爱斯基摩人。
Dr. Chen operated on Eason and has been an attending physician for neurosurgery for about 15 years.
叫我切
那你的脑袋我就知道我怎么样好好的还给
我
你。
打开这样剪开。
对。我们9楼是这个儿童神经外科的这，我每次下来的时候就觉得。 心里特别的开心，特别的放松。我觉得小孩子是最单纯、最真诚的。
不会看到那个伤口，不会怕。
因为我知道我是在救你。你把它弄痛了，你没有把它开好，它就是不理你。看到陈医师来，他就躲得远远。来，这手伸出来，然后 可是呢，你真的帮他把手术开好了，他知道他本来的病痛真的没有了，他就真的很开心，他就觉得哇，舒服很多。那你来的时候，他就很开心的跟你打招呼，期待你来查房，真的很好，都让我觉得非常非常的开心，更有成就感。
重点是我还要搬新家呢。
哎呦，
没有，
新家已经搬好了，
搬好了，
很空，
现在很大。
由你要去把它填满，好不好？
However, declining birth rates is an issue for doctors who specialize in pediatrics. In 2002, Taiwan's births was 248,000. But in a span of 20 years, it plummeted to almost half, at 139,000.
第一个是少子化，所以将来的市场病人的确会变少。但是其实如果你反向来思考，小孩子越生越少，是不是应该大家要更珍惜？是不是应该要更好的医疗服务？如果你没有看新闻，也应该知道这样子不肯改进之下，我们现在在很多偏乡，事实上是没有儿科急诊的。你假日晚上是没有儿科医生值班可以帮你们服务。 因为就没有啊。我们现在在很多儿童难产、产妇的这个死亡率都是比我们邻近的国家日本、韩国都还要高很多，而且是一直在退步哦。如果大家不正视这样的问题，我们曾经所谓很好的医疗或健保，那事实上是在往下走。我已经做了15年了，我现在也要50岁了。一个 神经外科的养成，除了住院师6年到7年，再加上后面专科医师之后的训练，事实上没有5到10年也是很难成熟的。所以呢，我现在如果不赶快训练，就没机会了，我们就断层了。
In 2025, Taiwan will become a super-aged society, where 20% of the population is above 65. This means more elderly residents will need health care, stretching an already strained system.
高兴的，空品觉得不在。好啊，病人去做检查了，所以检查回来再把那个结果跟我说一下。我们科有6年的住院医师，那科内有180床，所以你到围上去除的话，大概每个人都会有10几个病人，10个到20几个不等，这是我们比较一个平均数了。7年的罪，不好意思哦，我接个电话。早上 spinal cord injury 刚刚 MRI 做好，然后确定是第5、6那边 grade 2 subluxation cord injury。 我们病人数比较多，所以我们就会分配。有些病情比较严重的，那如果你负责的病人有在里面的话，我们会从他们先看。那加护病房的病况跟这些数据都比较多，所以一个病人可能会花15分钟左右。
有没有空调啊？
还是他可以在这边稍等一下。
17床。
17床。一般的病人的话，甚至是已经准备今天要出院了，基本上我们过去跟他评估一下他的肌力跟动作，如果都还不错，大概可能不到5分钟就可以完成一些比较简单的病人这样子。
他是 C spine injury 的病人，然后反正之前就左浪常常会容易塌，其实上一次18号是说左浪变塌，然后陆续25号、30号都 follow， 其实是做有进步。在台北荣总神经外科，目前我的期望值都有达到。那他的确实是很充实的训练内容也很丰富，工作时间也非常的长。好的部分就是我想要学的东西我都学得到，而且我不用去找其他医院或其他的个案来再加强学习。他今天的气可以吸得更饱，他肋间再多开一点了，但是这一边的水变多了。只是说比较遗憾的部分就是在工作以外的时间会比较少，所以陪家人的时间比较少，休闲娱乐的时间比较少。不是在聊天呢，我在安排那个厂商的手术的器械要准备，所以就会用这些时间。一个人要工作跟休闲要比较均衡，才会比较可以有持续永续性。当少掉这个部分的时候，其实是靠的是意志力在做一个撑下去的这样子的状况。
全世界走向高龄的过程当中，出生率也下降，就是以各个产业来讲，就是劳动人口的减少，劳动力的下降。医疗也是，当你到了主治医师以上，就是责任制了，人力越来越不足的情况之下，然后工作环境越来越辛苦，然后愿意从事的人就越来越少，可是你的服务的需求会大幅增加。这件事情其实会造成整个台湾在医疗体系上面走向一个很难永续的一个挑战。所以势必要有一些很明确而且比较大规模的体制上面的变革，否则这是一个没有办法永续的过程。
To escape the grind of the national healthcare system, physiotherapist David Chai left in 2010.
我离开了台北荣总。我可以觉得那3年其实就是用1个月左右的时间，一样的事情，然后跑了3年，而不是我做了3年的事情。老实说，那个时候其实非常沮丧，心里也觉得，到底这个专业未来发展要去哪里？好，双脚帮我弯到天空中，弯到天空中。好，帮我停在。我现在的这个工作方式跟我在健保体系里面最大的差别，就是我真的可以花一些时间，好好的了解这个病人的需要。所以那个动作待会在做的时候比较像这样，好，下去。以往的状况，他的需求可能已经被写在单子上面了，所以他来，我其实只要给他那些单子上写的东西，其实就可以满足这个整个行政的流程。可是我很少有机会可以问病人说：“那你觉得状况还好吗？”好，吸气，吐气。有一个自己的环境之后，大概有50分钟到60分钟左右的时间，我可以很好的问，很好的检查，发现他真正的问题。
Some Taiwanese, like avid runner Yu Tsun, are choosing to pay more for private health care and quality time with a physician.
我跑过4次全马，第一次应该是2004年。我04年跑完出马以后，我就开始膝盖很痛，然后我就去大医院看，后来就去做那个6次复健，1次50块那种。我记得我好像等1-2个小时吧，然后只有一个实习的物质师就跑来，然后就帮我搬一搬那个脚板，就说：“哦，你的脚板好像活动角度好小哦。”然后就走了。然后最后反正我那6次看完，我觉得完全没有好，膝盖还是在痛，然后就会让我觉得，我就算1次等50块，我就觉得他就同时在浪费我的钱跟时间，因为我没有好。
先用慢速度去感受那个这里可能会有被挤压的一种感觉，可以尝试着加一点速度。
那如果是大医院，可能连那个挂号费大概顶多400-500块，可是你看我去了6次没有好，然后我1个月来1次，我花个几千块，我1次就好。那我觉得其实对我来说，连时间成本下去，我觉得其实是划算。
抱歉，那我看比较这个是不好。
Taiwan's national health insurance is at a crossroads, faced with an aging demographic. Healthcare professionals say change in its cost structure is long overdue.
可是我们经过了20几年的健保，我们现在的健保花费还不到7%，不，我们的医疗了花费还不到 GDP 的7%，人家韩国已经爬到8%、9%去了，那日本也是9%左右，那我们还在6%多，大家只愿意花这么少的钱，然后但是又要最好的服务，然后每次只要健保要调费用，就一个部长、一个总统要下台，这个我不太能理解。
超高龄社会的台湾医疗体系或是健保的未来的答案，应该是要以社区的全人各项需求为主体，然后由服务的提供者去做一个跨领域的多元整合，再到政府部门去将体系、法规、支付作为一个相对应的配合，才能够去以更有效率的支付去提供所有民众的需求。
To discuss that episode and the challenges facing Taiwan's healthcare system, we're joined by our 2 guests. We have, first of all, Taiwan Jun, a clinical nurse working in Taipei, and then we also have Qiu Yifang, a psychotherapist and founder of the Taiwan Multicultural Counseling Association. Welcome to you both. First of all, I wondered if you could just give us an introduction to the fields that you're working in and some of the key challenges that are facing the fields.
Okay, so I've been working for more than 10 years in my field, and mostly I work for the emergency room. Then I think, according to the video, that it does something that we are really facing for, which is like nursing a living, or maybe go abroad, and also maybe leave the field because the high pressure and high working hours.
And do you think that those problems have got worse, or over the 10 years that you've been working in your field?
Well, I mean, it does solve a little bit of the while, but it gets worse now.
Mm-hmm. And Yifang, do you want to introduce a little bit about what you do and some of the challenges that are facing?
Sure, I'm in community mental health, so I work at a counseling center, but I have also worked in the school system as well, and the challenges that we are facing is definitely burnout or potential burnout. And the burnout comes from the full-time counselors in Taiwan. They have to take on an administrative job, and which might take up 70% of their time. And also in the community mental health, like me working at the counseling centers, the difference between Taiwan and the US is that Taiwan is lacking a community mental health model, which we collaborate with different professions. For example, in the US, we work closely with social workers, doctors, and the police. And you can call 911, call ambulance, call the police, or call CPS, Child Protective Services. But in Taiwan, we work alone, therapists work alone. And so this is creating a lot of problems for the patients and as well as the therapist burnout.
Mm-hmm. And what are some of the reasons you think the fields across Taiwan, medical fields across Taiwan, are facing shortages of staff? You mentioned nurses also facing shortages. What are some of the key reasons you think that those phenomena have come into being?
I think because it's not wealthy pay, because for the, like we run out of the shortage of the nurse and put a lot more pressure on the nurse who are really work on the practical area. So they have to put overwork on themselves. So meanwhile, they didn't increase the salary. So that's why they want to move out or leave the field, which is the worst one. And second, which is the work and life balance. Because I mean, we have to have the shift just turning like a night shift and day shift. And also, I mean, you can't really just say, oh, I want to have that day off anytime. So I think that will be the two main problems.
Mm-hmm. And Yifang, do you think the same issues are coming up in your field as well? Is there a lack of people wanting to go into psychotherapy in Taiwan?
If we talk about shortage, there is a shortage. For example, we have two hotlines, 24-hour hotline in Taiwan, 1995 and 1925. But the pickup rate for 1995 is about 33%, and 1925 is about 67%, meaning you call and there's a low chance of you really get helped by someone on the phone. So there is a need. And also universities, most universities have a wait list. The counseling centers have a wait list. You have to wait for a couple months or a semester. The shortage, I think it has a lot to do with it's a long training process. And in psychotherapy, we have to go to a graduate program, and then we have to go on a 1-year unpaid internship, and then finish this unpaid internship.
So how do you survive in that?
That would be a problem for a lot of families, because students are relying on families, and especially if you live in Taipei, you're definitely going to need your family support for that. And then you finish all this, you complete your thesis, and then you take the license exam, you become a therapist. And then all these years of training, and when you come out, you realize the income is not really worth the effort. It's not really worth it. So people are being discouraged and they are being burned out at work. So I do feel like the counselors in Taiwan, they do have to work longer and harder than in the US.
And is there a sense when it comes to psychotherapy specifically, that it's perceived as a relatively new field, and so maybe not enough people are aware that that's a career path? Is that another potential problem that you face?
So even though it's become increasingly popular in the past 5 years, it's still relatively a new field compared to the Western societies. So the counselors in Taiwan are facing a problem is that all the community mental health services, most of them are out of pocket. And it's not covered by any kinds of insurance, very, very few. So people are reluctant to go. It's cost inhibitive. And also the general public, because it is new, so the general public is lacking psychoeducation. So when they do go, they have to spend some time to figure out what this is and how they can utilize the services.
Yeah. How connected do you think all these issues are that are facing the healthcare system to broader issues that Taiwan is facing, that this video also talks about with the low birth rate? And one point I was particularly interested to hear your thoughts on was the relative lack of immigration, because in other countries that's often a policy that's enacted to alleviate pressure on healthcare systems. In the UK, for example, a lot of immigrants go and support the National Health Service. Do you think that's something that Taiwan should be encouraging more, getting more people in from different countries involved in the healthcare system to alleviate some of that pressure again?
Language is always a barrier because it may cause some safety on the practical area, because you don't understand what they are talking. So that's quite a little big gap for that part. And also, I think the other side of which is a low birth rate. Low birth rate, I think we can see that part, but if we can create a better environment for our staff, I think nobody really wants to leave their own country actually. So, has to solve their own problem by itself. But on the other hand, we can talk about the elder population actually, because elder population, they probably will getting more and more people, will become a big group of them. So it will cause lots of pressure on that, because even for their medical staff, they were getting old. And once they're getting old, who are going to taking care of them? Yourself or someone else. It's pretty hard to solve this part.
Yeah. Yeah, and Yifan, because I know you work with immigrants and you have different kind of strategies for dealing with patients from different people from different countries. So how do you kind of view the connection between those issues?
I think one big issue is the demographic change in Taiwan. 20 years ago, we rarely heard a lot of Southeast Asian, like Vietnamese and Indonesians, coming into the therapy room. But today, I have to say I'm seeing a huge Southeast Asian immigrant and migrant worker population. They need therapy, but they don't have anyone can provide the service to them, except for Philippines. They can speak English, but other than that, they are at high risk, but nowhere to go. And also we have a lot of cross-cultural families in Taiwan. And nowadays, not just the traditional Asian clients or American clients, I also see a lot of European and African clients on a regular basis. And they are real, they are here, they exist. But we don't have a lot of bilingual therapists to provide service to them, so demographic change.
One of the stereotypes that exists with people who come in and see the healthcare system in Taiwan is that Taiwanese people use the healthcare system a lot, and for problems that in other countries that people might not go to and engage with the healthcare system for flus or colds and that sort of thing. On the whole, do you think Taiwanese people overuse the already kind of limited resources that exist in the healthcare system?
As a professional staff, you can't really adopt someone else, but also you can see some people, like elder people, because they want to get the family attention, they go into the hospital, want to take some blood examination, just want to get some attention from their families actually. It's somehow you can't really say, you are lying, you are not ill, really.
Yeah. Do you reckon, Yifan, that's something that...
For the mental health field, a lot of Taiwanese people are relying on sleeping pills or antidepressant, anti-anxiety. So there's a number, 1 out of 5 Taiwanese are using sleeping pills as a supplement, which is number 1 in Asia and 2nd in the world. So how does that impact our work is that a lot of emotions are blunted the medication might change the behavior, but it might not always change the thoughts behind it. So that will cause a problem.
And a final question, looking ahead, how confident are you about the longevity of Taiwan's healthcare system? And for example, how confident are you that, when you retire eventually, that you'll be able to receive a good standard of healthcare? How confident are you about the future of Taiwan's healthcare system?
Well, my answer probably would be still yes, because even where population is getting older, the medical system are based on their income tax. So we can predict that older people are not paying the income tax in the future, and also low birth rate means we have less younger generations. They will put a lot more effort on the younger generation, but still the tax can come from the other area. So I still have the faith for that part, I think.
For me, I'm not that confident.
Got conflicting opinions, it's
Yeah.
good, yeah.
I think the current system is unsustainable. It's okay for now, but it's definitely unsustainable. And it's at the expense of younger people. And young people are losing hope. So if we don't pay attention to the cracks and do something about it, take actions, I won't say I am confident.
Thank you both so much for sharing your insights and thoughts. It's really appreciated. Thank you very much. And thank you to our audience. Join us next time for Gen Taiwan, where we delve into another topic with a great set of panelists. We'll see you next time.